during this COVID-19 pandemic. We in Oakland continue to be so grateful for all of our first responders, our healthcare workers, our grocery store and food workers, all of you on the front lines, and especially those of you who are taking care of our most vulnerable populations, working in our homeless shelters, our senior residences. And I do want to start tonight on somewhat of a somber note. We do want to extend our condolences and our concern for the friends and families of 3 people who passed away today from the Excel Healthcare Center on High Street, as well as the 36 patients who tested positive for COVID who are living in that facility. This is our moment to come together, and you are armed with 2 things: the advice that you get from your health professionals to socially distance, to cover your mouth with a cloth mask, but also to have information, to stay informed, to listen to experts. And that is just what we're going to do tonight. I'm very pleased that we're joined here tonight, first by Kim Wade McCoy. Kim McCoy Wade. Kim is the director of the California's Department on Aging. After my introductory report, Kim is going to talk to us about how we're taking care of our most vulnerable and what the special resources are out there. She'll give us an overview on food insecurity, as well as what special resources are out there for our most vulnerable, particularly our seniors. Next, we're going to be hearing from Kaiser's Dr. Stephen Perotti. Dr. Perotti is going to talk about testing. We all heard the big news this week that Kaiser is actually building a new testing lab. What does that mean, and what is available now versus what should we expect in the coming weeks and months ahead? And then finally, we are going to hear from Alameda County's Dr. Nicholas Moss. Dr. Moss is going to give us an overview on the state of tracing, contact tracing, why it's so important, and why it is going to mean everything about when we can get back to work and get back to our normal way of life. But right now, I am going to give you my report of what is going on in the city of Oakland. Before I get to my slides, every week we want to break some news so that you, the people of Oakland, hear it first, right here, rather than through typical news media. And this week we are very excited to announce a partnership with Roots Community Clinic to open a new test site in East Oakland. This test site will be the first walk-up test site. And you may have heard earlier in the week, Governor Gavin Newsom talking about sending new testing sites and providing them for 83 communities across California. Well, Oakland is one of the lucky communities to receive this resource. With the testing supported by the Verily platform and the stand-up and scaling and staffing supported by CORE, a wonderful nonprofit organization that is helping to scale this level of community testing. Oakland's partnership with Roots, and particularly serving the East Oakland community, is part of our work with the Disparities Task Force, a recognition that we have got to get into the communities and populations that are disproportionately at risk of both contracting and also having serious health effects from COVID-19. So I will be announcing more specifics in the days to come, but that is our big news in Oakland today, a testing site for East Oakland, supported by the governor's initiative. Now, for my slides. I wanted to give you first kind of a big picture overview of where the Bay Area is compared to other communities that have been particularly impacted by COVID. And the headline is, the Bay Area is crushing it. Crushing it, I mean that by saying that what we are doing appears to be working. We have certainly kept that curve down, and that means we cannot let up on social distancing, on wearing cloth coverings when we are out at stores and on errands. This is really good news, but it means we have got to do more. But you can see by this chart, and if you can't see online, if you're on the phone, just know that the Bay Area has one of the lowest weekly case rates, and that's the number of cases per 100,000 residents is the chart I'm showing. And we're compared to the county that Detroit, Michigan is in. New York City is at the highest point of any of these areas. New Orleans has really suffered. The US average is even above us. The Bay Area has much to be proud of. Next slide. To date, Alameda County has identified 1,235 positive cases. In Oakland, that is 366 cases. Next slide. Again, update on our attempts to get our unsheltered into these respite hotels. To date, 392 unsheltered residents have been moved into 2 hotels. And again, part of the governor's announcement last weekend, there is a Motel 6 in Oakland that is also in talks to become another facility for our unsheltered to be in safety and care. Next slide. A reminder that this week, the Alameda County Health Officer made wearing cloth coverings or a fabric mask the law. You can do it with a bandana, a scarf. There are YouTube videos to make one out of a t-shirt and 2 rubber bands. But don't forget, you still have to socially distance. Keep 6 feet away. Do not touch your face. And you do not have to wear them when you're outside engaging in physical exercise. Kids under 12 don't need to. And obviously you don't need to wear them when you're alone in your car or in your house. This is really when you're at the grocery store or riding public transit. Next slide. Oakland, in good news for the week, dispersed $500,000 in emergency grants to 90 amazing small businesses to help them weather this crisis. Next slide. Wait, back up. Somebody's not on mute. And also in good news for business, just today, the House passed a $484 billion interim coronavirus relief bill. One of the improvements of this, a lot of this is going to, again, provide more money for the PPP, the Paycheck Protection Program of the SBA. I and many others criticized the first round of that funding because much of it went to supposedly small businesses that were arguably not so small. We want to appreciate our California representatives that in this bill, CDFIs, which are community lending groups, and even some micro lenders are going to be able to get these loans, which are forgivable if used for paycheck protection, to our smallest micro businesses, many of the same ones that we just helped with the City of Oakland's micro loans that were made possible through the Oak Fund. And again, I should correct, those were grants, not loans, grants. Next slide. Testing is still available in the City of Oakland. We have 2 sites up while we are getting the East Oakland site up. Remember that it is available to anyone who is experiencing symptoms or believes that they have been exposed to someone who has COVID-19. If you are an Alameda County resident and you work or volunteer outside the home, you can use these free testing sites. Insurance is not required. We do not check citizenship. Please find out more and register for an appointment at oaklandca.gov/testing. Next slide. Another great resource, this is our resource of the week, just today on acgov.org. That's Alameda County's website. There is a fantastic interactive map of food distribution and services throughout Alameda County. You can see what's close to you, where you can get food, meals, groceries. Please check it out at acgov.org. All right. I do want to encourage you to, if you have not submitted questions in advance, our speakers are going to answer some of the top questions that were already submitted. But as you have questions as we go along, we encourage you to use Thought Exchange. You can scan the QR code that you're seeing now, or you can text 789-551-154. You can text that number to the number 72855. Again, you can text 787-551-154. You can text that to the number 72855. And we will be posting links to that. This is your chance to both post your own questions as well as vote on other people's questions that you want to hear answered. And with that, I am so pleased to introduce our first special speaker tonight. Kim Dacoit Wade is the director for all of California on the Department of Aging. And Kim, you are also a local here, so please, thank you for joining us tonight. And we're excited to hear about the resources that we have available right here in our own backyard. Kim.
Thank you so much, Mayor Schaaf, and thank you for including me all the way here from 65th Street in the north end of Oakland. So glad to be with you all. There is your roundup was so wonderful, Libby, just in terms of the breadth and the depth and all that's happening. So it's so tough and it's so fluid, and the city has been so responsive on so many fronts. It is super impressive, even in the midst of the terrible losses and terrible struggle that we're facing on both the public health and the economic side. So thank you for your leadership and partnership with California. I do want to start with food, because food is where it starts for so many of us. And older Californians, you said, Mayor Schaaf, about bending the curve. Older Californians were the first to stay home and are really driving that curve down. This community went home the first and will probably stay home the longest, given what we're hearing about how, and our public health and health leaders can talk to that. But we really want to acknowledge that older Californians and pay tribute to them for being the heroes in staying home, staying safe, answering the call. It's a different kind of public service, and it's a different service to stay home, but we're so grateful. Perhaps you can hear my family in the background as we're all, family dinner is still going on, even as the people's business goes on. So thank you to older Californians. And absolutely, one of the very first things as older Californians, and then increasingly all of us stay home, all of our families and friends stay home, how are we going to take care of food? Food is so basic, and how are we going to do it with both this public health stay home, try to stay out of grocery stores and crowded places, but also the economic crisis. So many people losing jobs, losing hours, losing income, and needing food. So I've been really pleased to partner with cities and counties and community-based groups in an unprecedented response. The programs I lead are what you might know as Meals on Wheels, the Older Americans Act programs that we're in the business of delivering. But guess what? Even more people need delivery now. And our other programs that you might have thought of as a senior center serving a lunch, well, like many of our services in the community, they had to reinvent and redesign overnight. And now our delivery service as well. So they are seeing unprecedented demand to help people stay home. And fortunately, we have received federal money through two of the stimulus bills, Families First, which has already come down to Oakland in Alameda County, in your community, and CARES, which is coming next. So there is some more funds, but there's not enough for the need. Your food bank, Alameda County Community Food Bank, is also a national leader on so many fronts, on organizing, on nutrition, on everything that makes community. And they also have received more funds, have done a lot with the little, reinvented services, relied on volunteers in new and different ways, and are moving food to drive through and pick up and delivery. Just we're all reinventing business as usual. And Libby, that map is wonderful to help people find things, because so many services have changed. And you need to access them in different ways. And I'm going to go through a bunch of them. And, we're so proud in Oakland and throughout the state, we're investing more in the 211 system so that no matter where you live, you have that no wrong door You can always start with 211 and find the Meals on Wheels. Start with 211, find the food bank. And then at the CalFresh program, some of us grew up with this at food stamps, but it's CalFresh. Last year, we expanded it to serve older adults and people with disabilities in whole new ways. And boy, howdy, are we glad we did that year ago, because that program is doing more than ever. And we're very, very happy that California next week, people will be able to have CalFresh, to use their CalFresh benefits to order online and have groceries delivered. Again, staying home. They're testing it in Sacramento this week. It's working fine. So it'll be coming statewide next week, that you can use your SNAP benefits coming on the card in May to start shopping online. So that's a huge breakthrough for millions of people. And we hope we'll even attract more people to use the program who maybe didn't before, or unfortunately now have new economic need. These are not my program areas, but my heart is with the school meals programs and all the schools. Again, redesigning business, getting food out there to kids and families and seniors, feeding the community. Schools are the hearts of our community. And even us, our youngest children, we've changed the rules to make them more flexible for the WIC program. So usually all these programs rely on in-person touch. Let's weigh the babies and make sure they're healthy, but this isn't the time for touch right now unless we need to do it. And our programs are really rising to meet the moment and make sure food is out there. So if you have questions about any of that, 211 is the place to start. I will say, I'll give you a little preview. I know the mayor knows that the governor has been very excited about a new First in the Nation partnership with FEMA to use FEMA disaster funds to partner with local restaurants to buy meals for seniors and other high-risk adults who are staying at home. And there's going to be more news about that tomorrow, and we're really eager to get that out the door. Tune in to Governor Newsom's Newsom at Noon daily press conference to get the latest and have that come out, hit the ground. You know, really inspired by Steph and Aisha Curry's work here in Oakland and many other Oaklander leaders and Oakland restaurateurs, and we're taking that statewide. So thank you to Oakland for showing that, how to do it, and then FEMA for approving it. I think the last thing I'll say before I hand it off is we've been now a month in this business. And if there's one thing it's clear, it's really going to be about more than food. And the big issue for the older community that we're seeing more and more is that as people are physically isolating, the social isolation is creeping up. And the loneliness that comes from being home and looking at your week and your volunteering isn't happening, your library isn't happening, your grandkids aren't coming over, your exercise class isn't happening. So it's on all of us. If I leave you with one thing besides the food message, is reach out. You have to call people you know. You have to knock on that door and leave the note. If you don't see somebody, you can always call your Adult Protective Services and do a wellness check. We just invested in a statewide friendship line so that you can call 24/7 and talk to someone. We don't want anyone to be lonely. We know that being lonely actually is terrible for your health as well as feeling terrible. It's about the equivalent of 15 cigarettes a day. So we need to get you that food, but we also need that connection. So that's where we really are rallying on the spirit of Oakland and other communities to stay connected, know your neighbors, know your family and friends, make those 5 calls. And if someone does need help, you can call 211 and find the services in Oakland to help meet their needs and close those gaps. So with that, I'll stop. We have a great panel and look forward to the conversation tonight.
Great. Thank you, Kim. Do you happen to have that phone number for the friendship line?
I do. It's not a catchy one, but let me just say it. It is 1-888-670-1360. So 670-1360, and it's 24/7. You can just call to chat. You can call to have a conversation, and you can also call if you're having a really tough time. They're ready for that too. But it's really just to reach out if you want to have a friendly conversation. Any adult, the friendship line is there for you.
Great. That is fantastic. And just for Oaklanders, we are actually going to be pretty soon launching, we call it the Great Oakland Check-In. So we're going to be using volunteers to actually call our seniors throughout the city. Similar idea. We really want to make sure everybody's well and they know what resources they have available. Now, I know testing is on everybody's mind. Dr. Stephen Perotti from Kaiser Permanente, I think roughly 40% of insured Oaklanders are Kaiser members. I know my family is one of them. Please tell us, what is the latest in testing now and what is to come? Because it feels like every day things are changing around what we know about this disease and what our life is going to be like in the future. Dr. Perotti, thank you for joining us.
Thank you, Mayor Schaaf. It's such a pleasure to be speaking to you. Actually, I'm here in Oakland too, at 1950 Franklin. So it's really a pleasure to be with all of you. And you're right, it is significantly changing. And actually, some of the slides you were talking about are only possible because we're able to do the testing. So let me just sort of give you really the journey that we've been on. So if you think about just a month ago, the entire state of California really had the capability of only doing about 100 to 500 tests a day. And within the Kaiser Permanente system now, we're doing about 1,300 tests a day. And what that allows us to do is really expand the ability to widen who we're testing. So really, just a month ago, we were only able to test the people that were coming into emergency departments or into our hospital systems. And so we've now been able to widen the net, essentially, if you will. So we're now able to test folks that are on the outpatient side. That means that you're coming in and that we're able to assess, are you at higher for complications from COVID-19, and then able to apply that testing in a more widespread fashion. And this is going to be critically important for us to understand how the disease is spreading in the community, but more importantly, to be able to do what I know my fellow doctor is going to be talking about after me, Dr. Moss, about contact tracing. So being able to find people that were in contact with somebody with COVID, and then finding out whether or not those people actually have COVID-19 as well. That's going to allow us to do more selective isolation as opposed to the general isolation that we have in place now, what we call non-pharmaceutical interventions or sheltering in place. And really, we are committed to actually increasing the amount of testing to be able to get to that capability within Alameda County. So we are literally opening up the lab that Mayor Schaaf was referring to over the next couple of weeks. It's a new 7,000 square foot lab that's going to allow us to increase the PCR testing, which is the testing to identify disease, up to about 10,000 tests per day. So that's going to allow for just wider spread public health intervention. The second new front when it comes to testing is the ability to do what we call point of care testing. That means that we actually run the test on site. So if you come to our Oakland facility, you come to our San Leandro facility, we're able to do a test right there on site and get results back within hours as opposed to a day. And that's going to be critically important for our emergency departments and our hospitals. It allows us to determine whether or not we need to use all that personal protective equipment that is right now in short supply all over the country. And it also allows us to get a quicker answer to all of you. There's a lot of quality assurance testing to make sure that the tests are accurate. That's really our main focus, is to make sure that not only do we have the testing volume to respond to the community's needs, but also that you're getting the right information. The next set of tests that are going to be coming online, and it's really over the next 2 to 3 weeks, is some of what you've probably heard about, which is blood testing. And this is really going to allow us to understand who's been exposed to COVID-19. So these are antibody tests that we use for other types of viral diseases. We're going to have that available for COVID-19. This will begin to allow us to understand how much of the community has been affected by COVID-19. We saw some recent testing out of Stanford that actually showed that about 4% of the population in Santa Clara County has been exposed to COVID-19. We hope, to contribute to both the state of California's efforts, Alameda County Public Health's efforts, as well as Kaiser Permanente, to begin to do some of the antibody studies that need to be done in each of the counties, so that public officials like Mayor Schaaf, public health departments can begin to make some rational decisions about what can be opened up, what actually still needs to be sheltered in place. And a lot of you were asking about, in the chat function, who are you going to make that available to? So the antibody testing is going to be more important from the public health perspective. So more broader based testing as opposed to individual testing. The individual testing is still going to be that classic nasopharyngeal swab that we do to diagnose whether or not you have the disease right at the moment. As the disease becomes more prevalent, meaning that we have an understanding of how many people have been infected, we'll make the antibody testing more widely available. Another question that really came up here is who can get the test? And so we're really committed to making this much more widely available. So I really anticipate over the next 2 to 4 weeks, particularly for Oakland and Alameda County, that we're going to be able to make this more widely available. Governor Newsom made an announcement yesterday, which was actually music to my ears, is that we're getting a whole number of swabs. That, believe it or not, has been one of the big limiting factors. So it's not so much actually having the lab up and running. We literally have to have the swabs and the test reagents to be able to run the test. It doesn't do any good to have the machine and have no swab to use for a patient. So the commitment by the state and California Department of Public Health to distribute those swabs to providers like me. I'm an infectious disease doc, so I use these regularly. That's going to be key and important. And the other thing that I'll just mention that's coming online is that we're working with industry partners to make these swabs more available. So in fact, yesterday, my colleague who runs the lab came up to me and said, look, I have a 3D printed swab. And so we're working with actually the tech industry to make those swabs more available, not just through the usual means, but also through, I think, pretty unique means. So with that, I'm going to go ahead and turn it back over to the mayor.
Great. Thank you, Dr. Perotti. We are so honored to have Kaiser Permanente's headquarters right here in Oakland and all the great work you all do. Next, we're going to hear from Dr. Nicholas Moss. Dr. Moss is with our own Alameda County Health Department, and he's going to talk about the importance of tracing. I understand the county actually has recently stood up a task force on tracing. I know everyone's going to want to hear about this because it is going to make a big difference to when we can get back to work. Dr. Moss.
Thank you, Mayor Schaaf, and I appreciate being invited to join the call and being able to represent the department. And I also want to thank you for your leadership so far during the epidemic and for Oakland's efforts, particularly on testing, as has been mentioned. So contact tracing, it's been in the news now a lot. For those of us who work in public health, we kind of live and breathe it, but it's interesting to see it becoming such a part of the discussion around COVID, and it is very important. It's a tool that we use to control the spread of communicable diseases in public health, and it's actually very routine. We're doing it all the time, but in a situation like this, if you think of an epidemic as a fire, contact tracing is like pouring water on the embers to keep it from spreading. And so it's really important when we have a situation like this where we have a lot of infection moving through the community. So as with many other conditions, all COVID-19 cases must be reported to the Public Health Department by law. And contact tracing refers to the things that we do as a department. It's really part of our duties to limit the spread of COVID-19 when a case is reported. It's really critical to our overall efforts to protect the health of the community in Oakland and throughout the county. The Public Health Department is responsible for doing this, except in Berkeley, which has its own health department. And so they work independently, but we're friends. We do work closely, not just with Berkeley, but also with healthcare providers and other partners when necessary to do this work. This is my first slide, and it's an illustration of what contact tracing is. And so the first step is investigating that reported case. So making sure that we, the health department, have all the facts right. And as part of that investigation, we hope to learn who else connected to the case may have COVID-19 or may have been exposed to it. We call each of these connections contacts. We also try to find out if there was a specific place or situation where a case became infected so we can stop any ongoing spread there. You often hear about this kind of thing in the news. For example, a few years ago, we had some measles cases in Alameda County and throughout California that turned out to be related to some spread that happened at a amusement park in Southern California that I shall remain nameless. After the initial investigation, we do a few things. We make sure that the person with COVID knows to stay home until they're no longer contagious, and we call this isolation. We also reach out to each contact of that person to see how they're doing first and foremost. And if they feel well, we instruct them to stay home for 2 weeks after their exposure to avoid passing COVID on to somebody else. And we know that when people get sick from COVID, sometimes they can start to pass it on before they feel symptoms, or even they may not even really realize they have it at all. So it's really important that we have people stay home after the exposure. And we call that quarantine when they're not sick, but we're asking them to stay home. If a person is sick, if that contact is sick that we've identified through our investigation, and they're able to safely access testing, we do recommend testing. But what's most important is that they stay home and they don't expose other people and potentially pass on COVID. If we diagnose COVID in that contact, the whole cycle starts again, and we'll do an investigation. We'll identify if there's anybody else exposed that we need to follow up on. Now, if this system works well, we keep people with COVID from passing the infection on to too many other people, and we keep the epidemic under control. As we do this, the whole thing really depends on cooperation, working well with community members who are impacted by COVID, building trust. We are really careful to protect privacy, similar to a doctor's office, or even more so. And we consider these activities of public trust, and if we aren't protecting community members and working for their health, we really can't do it and be successful. So right now, with so many of our community members sheltering in place, wearing masks and otherwise social distancing, as we call it, we have actually kept, as the mayor was saying, we've kept COVID-19 under control in the Bay Area and in Alameda County. But we can't do this forever. We need people to be able to go back to work. We need people to be able to go back to school. We need to be able to interact with each other, address some of those issues about people getting all their things that they need in life and contact with other people. So extensive contact tracing, along with increased access to testing, will help us keep COVID under control as we start to relax these social distancing measures and start trying to get, life back to something like normal again. And we really need to plan for that. And as the mayor mentioned, we are actually doing a lot of work at the Public Health Department to do that. And contact tracing is really only one part of what we're doing. Our overall COVID strategy does depend on partnering with Oakland and our other cities, community members, healthcare providers, and laboratories to increase testing. And I'm very excited about what Oakland is doing, and also what Kaiser is doing, what Dr. Brody mentioned, because without those testing efforts, we actually don't know who has COVID, and we can't do contact tracing. So it all really does lead back to testing. And of course, we need strategies to support people who are who need to be in isolation or quarantine. So we can't just ask somebody to stay home for a week because they have COVID. We need to make sure that their medical needs are able to be met, that they can access food, that they have their other family needs are met, childcare. Sometimes people are concerned about losing their job. So we really can't just tell somebody to stay home. We have to make sure that we're addressing these other needs. And, I think we have to do things like this call. We have to communicate better with the whole community about how these things work and what the benefits are, so that we can really stay ahead. Another thing that we need to do as part of our larger contact tracing efforts is we really need to do a better job understanding and addressing how COVID is impacting communities that have experienced structural racism and marginalization and may not have the level of access to healthcare that others do. And I think that's really important as we build trust to do these other activities that we're talking about. In my second slide, you can see just a brief outline of some details of what we're doing with our expanded contact tracing. And as the mayor mentioned, we are scaling up our contact tracing team. The team that handles this kind of work normally has just 7 people. And right now we have 60 people working on all aspects of COVID case investigations, including 17 people who are trained just to follow up with those contacts and check in with them. We're training more people every week. And as we start to think about having thousands of cases of COVID, and with each of those people having 2, 3, maybe 10, maybe more contacts who may have been exposed, we are planning to have as many as 100 to even 300 people doing contact tracing here in Alameda County in order to really meet the need. And we'll need to use some technological tools to support this. Alameda County and our other partner health jurisdictions in the Bay Area and across the state are in communication about how we can be better coordinated around this. And we'll need to continue to work with the city of Oakland and other partners in order to coordinate this with efforts like the testing programs and other things that we need to be successful as a county. I do also want to say we are so glad to hear of all the people who are now interested and want to come and support contact tracing activities, and we are looking forward to taking advantage of those offers and trying to put a system in place for using all that support. The public health department, although our communicable disease team in normal times is pretty small, we have a lot of staff we've been able to draw on so far in order to support these and other efforts related to COVID. But we do want to look ahead to having many more people involved, and we do want to make use of those resources. So I want to thank folks who have already come and said, how can we help? How can we help do this right? I think I'll leave it there, and looking forward to answering some questions.
Great. Thank you so much, Dr. Moss. This is going to be a big new part of our vocabulary, contact tracing. This is the point at which, and I don't know if you can put back up the slide with the QR code and the text. This is a point at which you can either enter into social media or text us any questions that you have for our special speakers. We are going to stay on with you until 7:30 tonight, and thank you for being with us. We want to answer the questions you have. And while you do that, and again, if you're on the phone, but you have texting ability, you can text the number 72855. You can text that number to the number 787-551-154. But those of you online, just please click, give us your questions. I'm going to answer some of the advanced questions I got from viewers while we wait for your new questions to come in. The first question I got was about credit cards and debt. If we can't pay the mortgage or buy food, how do credit card companies expect to get paid? And it says banks continue to rake in record profit. We bailed them out. Now they want more. What are you going to do about it? So I can tell you that regulating banks is the purview of the federal government. Oakland has actually tried, and we got sued, and we lost all the way at the Supreme Court. So we know very well. But what I am finding is that most banks, in fact, all the major banks, are offering mortgage forbearance. And that means that they are giving people 3 months of no payment obligations. I did go onto Visa's website, and it says to check with your bank. The Visa company itself does not offer this. They service banks. So go to your bank. If you have any type of debt, student loans, mortgages, small business loans, consumer debt, go to your bank and ask them. Most of these banks are not automatically giving any sort of debt relief or forbearance. You have to apply for it, but most of them are giving it if you ask. Please go ask. And if you are finding banks that are not giving any sort of delays or deferral on payments, please let us know, and we would be happy to go talk with them and try and convince them to do the right thing. Another question I got was bulky pickup. Everyone is doing cleaning projects without bulky pickup. They're dumping all over East Oakland. Can bulky pickup be turned back on? It's true that while we are sheltering in place, it seems like illegal dumpers are not. You can still report illegal dumping to 311. You can dial that from anywhere in Oakland, or you can email oak311@oaklandca.gov. Now, I will tell you that most of our public works workers are in shelter in place, but we have agreed that they will come back to work on May 4th. I'm actually talking to the head of the Western region for waste management. They are our garbage provider, because they have suspended the bulky pickup service. You know, you can get junk picked up in front of your house. They are not doing it right now. I'm going to try and convince him to change his mind about that. Instead, we are going to be asking them if they would provide people with vouchers so you can drive it to the dump yourself. So while waste management is not doing bulky waste pickup, the dump in San Leandro on Davis Street is still open, and we are working on getting you free vouchers. And similar to that, someone asked about when are we going to be disinfecting the sidewalks and streets. Again, we are hoping to get our street workers back out there cleaning up starting May 4th. And then we will work with the health professionals about what type of disinfecting is going to be safe for our storm drain system, for residents, and help us get back to our daily lives in a healthy way. Third question that had a high score was asking about small business relief. Businesses without large employee payrolls are still impacted, but federal programs do not support them adequately. That is definitely what I have found. I know of almost no businesses in Oakland that got that first round of SBA loans. Please visit oaklandbusinesscenter.com. And that's true. I got a question for a landlord. That is also a small business. oaklandbusinesscenter.com has information about what's available. Just as of today, new money for the PPP SBA forgivable loans was approved. And unlike the first round, that was only available through traditional banks, thanks to our California representatives, Senator Kamala Harris and Feinstein, and our Congresswoman Barbara Lee, the community lenders like Working Solutions, and even possibly micro lenders like Kiva.com are going to be authorized. PayPal and Intuit are authorized to process these loans. So please get in line now. This money literally just got approved today. We want Oaklanders to benefit from it. And I do want to put a special pitch in for Kiva.org. You can get a zero interest, zero fee loan through Kiva, $15,000, no repayments for at least 6 months. And you Oaklanders that still are earning a paycheck, please consider lending to an Oakland business that is borrowing through Kiva. All right, last question. I'm going to answer two more quick questions before we go back to the questions that are coming in through Thought Exchange. Question about a tenant. I've been forced out of work since the stay-at-home order in March. What is the plan for people like me who can't pay rent and won't be able to pay 3 months all at once? What happens at the end of my lease? And there's a similar question about why are rent increases being allowed at all during this time? It is very important that everyone knows Oakland has adopted the strongest eviction moratorium of any city in California. The state has a certain eviction moratorium, but Oakland's is slightly stronger. So if you don't live in Oakland, please see what your laws are. But in Oakland, you do not currently, you cannot be evicted. If you can pay the rent, we encourage you to pay it because your rent is still owed. And I've been asked, why has the city council not passed rent relief or rent forgiveness? That is because it is not within our legal authority to intervene in a contract or to take a property value away from someone else. So rent forgiveness is not something that the city can do by pass a law. We have, however, stood up a wonderful public-private partnership called Keep Oakland Housed. Please put that in our resource box, keepoaklandhoused.org, or just like Kim was talking about 211, you can also get connected through 211. There is emergency funding for paying back rent or utilities owed for low-income people through Keep Oakland Housed. But know that the Oakland City Council is likely to extend the eviction moratorium as this shelter in place continues. And while the owing of rent is something that is still something that you do have to do, you cannot be evicted for rent that you can demonstrate you are unable to pay due to COVID-19. That is something that's unique to Oakland's rental eviction moratorium. And last but not least, I encourage you to get legal assistance and support from centrolegal.org or from the City of Oakland's Rent Adjustment Program. Just Google Oakland Eviction Moratorium. It will take you right to the Rent Adjustment Program. And we are going to be providing mediators to try and work out payment plans between renters and their landlords so that everyone comes out of this whole. So those are some of the quick questions that I've gotten. I know I had some more about homelessness. Do I have time to answer one more while we're putting up the thought exchange questions? I think so.
Go ahead, Mayor.
Okay, thank you. All right, I got a couple of questions. Oh, here's a happy question, and then I'll tell about homelessness. Street closures. Someone says that they have a dance event in their street every evening, and they would like to be able to close off their lightly traveled street for an hour. Well, you probably have heard about our Slow Streets initiative. It's actually getting national attention. If your neighborhood would like to be part of Slow Streets, please email oak311@oaklandca.gov. We are willing to take into account community votes for which streets neighbors actually want to be limited or closed off to through traffic. Again, all streets are still open to local traffic, emergency vehicles, deliveries. But if you want to be considered for a slow street, again, email oak311@oaklandca.gov. And then finally, I got a lot of questions about how we are taking care of our homeless. Again, know that we are trying to secure hotels. It is a costly endeavor. FEMA does pay for some of it, but not all of it. And we are working as quickly and responsibly as we can to not only get our unsheltered neighbors that are showing COVID symptoms into a special isolation hospital where they get appropriate care, but also our unsheltered residents who are senior citizens or have an underlying health condition. They are a priority as we are trying to get them off the streets and into shelter. I can assure you that we have gone through our shelter system in the city of Oakland and ensured that everyone is socially distanced. We have used some of the first funds raised from the COVID relief fund to do additional cleaning, disinfecting, and regular hygiene. We've doubled the hygiene interventions such as hand washing stations, porta potties, and trash service in our larger encampments in the city. Now 40 of them have these supports, and we are working with our incredible outreach workers and shelter providers to get out hand sanitizer, hygiene instructions into our homeless population. And then also, we have been doing hundreds and hundreds of meals every day at our encampments and at our different shelters. I want to give a special shout out to the World Central Kitchen. Chef Andre is on the cover of Time magazine this week. They came to Oakland to help with the Grand Princess disembarkation. They've never left. They are literally helping us feed our most vulnerable by the hundreds and thousands every day. So those are some of the efforts that we are engaged in now, and we will continue to try our very best to expand this. This is one of our highest priorities, even as we are facing an $80 million budget deficit with the city of Oakland because of the hit to our revenues through the shelter in place. We are trying to keep our homeless as our highest priority and to serve those who are most vulnerable and who have been subjected to health disparities for many decades, first and foremost in our priorities. With that, can I ask if you're ready yet, Ivana, with the questions? I mean, I have more, but I want to.
We are ready.
All right, let's thought exchange. Let's see what you've given us. All right. Okay. I'll hit the first one. The first question is, will there be more garbage and hand washing stations put outside most essential businesses and public spaces disinfected? I'm going to give you an answer that I think public officials need to use more, which is, I don't know. We are every day, every week, reassessing what we know about this health crisis and what the best ways are for us to slowly and safely open back out. I can tell you that when we went under the first shelter in place, we had modified, for example, public spaces in City Hall to require social distancing from our workers and to require the use of hand sanitizer before someone came up front in line. And I suspect that those are the types of practices that we will be learning, but we're going to work carefully with our health professionals. This is the time to put facts in front of fear and also to really trust our health professionals about how we can gently reopen our economy and our city. The next question is the city providing masks to folks who cannot afford to buy one or for folks who don't have access. Everyone must be protected. I have to again emphasize that the masks that are required right now are cloth masks. You can make them out of a t-shirt, you can use a scarf, you can use a bandana. Most people should have the materials to create this kind of mask by themselves. I am excited to share, though, that our interim police chief, Susan Mannheimer, has been able to secure some masks for our police officers. We are not at this time giving out citations for failure to wear masks. Instead, we are giving out masks. So it's all about reinforcement before enforcement. And I don't know if Dr. Perotti or Dr. Moss want to add something about why it's important that people wear cloth masks and don't actually compete with medical masks. Why is that important?
Yeah, so thank you, Mayor Schaaf. It is actually critically important to use the cloth masks and what we're calling cover your cough masks. So one is that, just let me say, it's important to be wearing the mask because it actually helps prevent spread in the community. However, to your point, medical grade masks are in very short supply, particularly the ones that are called N95 respirators. Those are the ones that healthcare workers critically need for the care of patients that are undergoing procedures in our hospitals, where there are possibilities of generating what we call aerosols. And really they're specialized masks for those purposes. And right now the supplies coming from China and really even from within the United States are extremely limited. So preserving those for our healthcare workers is really important. And at the same time, using these other masks when you're either in public or actually when you're coming and accessing the healthcare system, critically important. Helps protect each other, helps protect the healthcare workers so that we can all be here to take care of you.
I'm sorry, I forgot to unmute myself. The next question is probably for Dr. Moss. When will the antibody test be available to everyone in Oakland who wants it? We need to protect each other. And then Dr. Moss, when you're done, we'll go, maybe you can also take the next one about, what about people who are not in Kaiser? Are you able to read the questions? Are you seeing them okay?
I can see them, yeah. And Dr. Prodi may also want to jump in about the antibody test. And as you mentioned, they are starting to become available, but there's a few things that I would caution about them right now. So they're very useful, and you're starting to hear about this in the news. They're useful to get a sense of how widespread COVID is in our communities. In a way, you can look back in time and with that and see if it was spreading more than we thought. And but what we don't quite know yet is whether an antibody test, if you have antibodies, whether that means that you're immune from getting COVID again. And so I just want to caution folks, a lot of us are hopeful that that will be the case, and we're looking for more information from the scientific community to say that, but I don't think we're there yet. And then if we did have that, we would want to be able to use that test to be able to know, who had already been exposed and might be immune, and who wasn't. But I don't think we're quite there yet. Dr. Prodi, I don't know if you wanted to add.
Ross, I think you're exactly right. So from our standpoint, this is going to be something that's ramping up over the several weeks and really months to come. And I think it's going to be critically important that we contribute to the studies that are being done right now to understand the significance of the antibodies, because I think that second part of the question is what we all want to know. Are the antibodies protective, and how long are they protective for? So that's actually going to be a process over months to actually understand those questions. It's also going to require wider spread testing to be able to know those answers. So I know that we're going to be partnering with the public health community to be able to answer those questions.
Thank you. And the next two questions I'll take because they're about our unsheltered neighbors. Why can't you cancel the rent and house people in vacant hotels? And every unhoused citizen of Oakland needs a safe and hygienic place to shelter in place. I could not agree with you more about this sentiment. Housing is a right. It is something that everyone deserves. It is morally outrageous that a region as wealthy as ours, a country that purports to be as great as ours, tolerates homelessness. That is my greatest passion and belief. But we are limited by our resources as well as the laws. And this is a moment to remember that your city, your county, your state governments, we all have to pass balanced budgets. It is only the federal government that has the ability to come to our aid right now. It is only the federal government that often controls certain areas of the law. And so we are really hoping that they will come to our aid. Oakland just barely missed getting a direct allocation as a big city. The cutoff was 500,000. We're just under that. I can tell you the city of Sacramento received a direct allocation of more than $80 million, which is basically our budget deficit right now. So we are doing what we can. We are definitely prioritizing this, but we are limited in our resources and we are limited in what we can do under the law. Why don't one of the doctors answer the question? I'll start with, can police stop you if you don't wear a mask or scarf? The answer is yes. Police can stop you. They even can give you a fine. They could, if they wanted, apparently imprison you. I don't think that's happening. I can tell you that in Oakland, it is my belief that people are stressed out and struggling for money as it is, and that monetary fines are not productive right now. But it is the law. And certainly flagrant violations. Our police are enforcing if there are large scale parties, sideshows are places where they will enforce, but just an individual who isn't wearing a mask or scarf, our policy is to actually give them a mask. But can one of the doctors say why it's important to have a face covering?
Yeah, sure. I'll take a stab at it. And I'll also talk to the question here about, is the virus airborne? So the virus is actually primarily spread by what we call respiratory droplets. So those are basically heavy, like spittle that comes out, and they literally do what we call drop. That's why they're called droplets. They can spread about 3 to 6 feet. And the advantage to wearing that facial covering is that you're basically preventing those droplets from getting out. So you're protecting all the people around you when you're wearing these facial coverings. You've probably heard in the news some stuff about the airborne potential for this virus, and that's really in the medical setting. So if we're performing certain procedures in the medical setting, particularly around specific treatments for respiratory therapy, if we're doing intubation, meaning we're putting somebody on a ventilator, that's where we need to be wearing the special isolation masks that we have in the hospital. But otherwise, for the general public, when you're out and about, it's really spread by droplets.
Oh, thank you. And then Dr. Moss, someone wants to volunteer for contact tracing. How can they help?
Yeah, and we are, again, grateful for the number of people who have stepped up and offered to help, not just with contact tracing, but with all aspects of the COVID response. Certainly at the Public Health Department, many offers, and we have actually brought some volunteers on board who have some special skills and some medical skills. We are not yet in a place where we need or are ready to bring on volunteers for contact tracing. I think we're still some weeks away from that, and I appreciate that, and we will be sure to share information on that opportunity when it is available. And I think part of the reason that we're not quite there yet is the shelter in place and some of the other things that have been done. We've been able to hit pause and really plan to expand this contact tracing in a planned way. So look forward for more information from us.
Great. And then Kim, the next question is for you regarding unhoused residents who are being moved to hotels. If they're 60 or older, are they immediately eligible for Meals on Wheels service or anything else?
Yes, that is one of the options, although we are working in partnership with local leaders like yourself to decide what is the best way to bring food into those residences. Sometimes you're going to want to do a kitchen partnership with someone like the World Kitchen or possibly with Red Cross. Sometimes you're going to want to, if residents have kitchens or any kind of facilities, use the CalFresh. Some of those residents might have in-home supportive service workers who can help them with meal preparation. So this is why supported housing is so important. It's not, the roof is very, very important, but also that support to help connect the resident with meals. We absolutely agree. I know the mayor does too, that wraparound of both the roof, of course, and the warmth and the safety and the food. But yes, they would be eligible for Meals on Wheels. They could be eligible for CalFresh. They could be eligible for other food programs that can meet them where they are. I just want to say a special thank you, though, as you mentioned this issue. The issue of elder homeless is really a profound issue as well. That more than half of homeless people are over 50, and most of them are homeless for the first time. And so all the work that St. Mary's Center here in Oakland and Dr. Margot Cushell and you, Mayor, are doing to address the whole complexity of homelessness is just so appreciated and such a model for the region and the nation. Thank you for it.
Well, I wish we had more to show for it, but you're welcome. Again, at the hotels, we are providing meal service, so those seniors don't need Meals on Wheels because that's part of why the hotels are costly to operate, because it includes, housekeeping, meals, medical care, etc. We're not. It is irresponsible to just open up an empty building and tell people to come in and not provide any support for them. So that is not what we're doing. We are definitely supporting people in those hotels. The next two questions, definitely the next one is, in fact, probably both of them are for Dr. Moss. Is Oakland or really Alameda County partnering with Airbnb to match individuals with spare rooms with those who need to isolate because of COVID as we step up contact tracing? Again, I can say I am not doing that yet, but that's something I could do if the county is not doing it. And then how many Oakland residents are tested daily, or maybe Alameda County residents? Oakland is running 2 testing sites. We have the capacity to do just under 500 tests a day, and our new site will be another 250 a day. But how many are actually getting tested? That is probably something only the county knows.
So it's interesting. I was just looking at the Airbnb website today. We do not have a current partnership with Airbnb, but I was wondering what they're sort of saying publicly to customers about COVID. And the county has worked on some of the facilities that the mayor has mentioned. We've partnered in those efforts to get housing for unhoused individuals. But we know that there is a need as well to create isolation housing options for other people who may not be unhoused, but may need to be isolated away from, for example, family members who maybe are particularly vulnerable for COVID and other situations that arise. So that there are people working on this at the county. We don't have an arrangement with Airbnb at this time. And then in terms of the number of residents tested daily, I don't have that figure in front of me, although we do get information on tests. And I know that it is on the order of hundreds, and we want it to be on the order of thousands of people tested every day in order to really meet the need. I think that the target right now is 2,500 tests a day for a county the size of Alameda County, including Berkeley. And so we're far short of where we want to get for the county in terms of the amount of testing.
Great, thank you. I am aware, though, that Airbnb is offering their hosts to host first responders and healthcare workers who want to stay close to their patients, but also separate from their families just because their high rate of exposure. So I am familiar with Airbnb, again, hosting frontline responders, healthcare workers and first responders, but I'm not aware of them host people who have actually been tested as positive. There's a question about unemployment help for self-employers. Again, I encourage you to go to edd.ca.gov. That's the state of California's website for unemployment benefits. Everything is different right now. Gig workers, contractors, sole proprietors, self-employed folks are eligible for unemployment benefits, or what they call PUA, Pandemic Unemployment Assistance, that has never been available before. So if you have any doubts, apply. The 1 week waiting period is waived. Again, everything is very different and much more supportive. If you're looking for a good resource, if you've got employment benefit questions, I highly recommend legalaid@work.org. Legal Aid at Work. They even are doing phone counseling if you are interested in getting help for unemployment benefits or income interruption benefits. Again, the question is, how is the city dealing with people not wearing masks when close to other people? As I said before, and this could change, but it is my opinion that it is not constructive in this moment to be giving people fines. We are, again, giving them warnings. We are educating them. And as of this week, some of our officers are actually armed with masks to provide to people. We are seeing right now, the data suggests that the Bay Area actually has a very high level of compliance with the stay-at-home order. Now, if that changes, and we are certainly trying to do some targeted education, particularly in parts of East and West Oakland, where we are hearing complaints of low compliance and people not wearing masks. We are going to be doing some special outreach and communication in those neighborhoods. But if you do want to report somebody who you believe is breaking the shelter in place order, maybe a business that should not be open, you can email these violations to COVID-19 compliance at acgov.org. Again, COVID-19 compliance at acgov.org to report violations of the health order. I'm not quite sure if one of the doctors want to take, is there a limit on housing for those quarantined and homeless in certain areas without statistics? I'm not quite sure what that means. Does anyone else want to take a stab at that?
If it's referring to just the capacity of some of the hotels that have been set up for unhoused people for isolation, or the populations, the vulnerable populations, I know that there are only so many hotels and rooms so far. So in terms of the limit, I think they could fill. I'm not aware that they're close to filling at this time, but I'm less closely tied to that program. And I know that there's interest in adding additional capacity. I don't know if that answers the question.
There's a question about whether we're collecting the vacant property tax. The answer is yes. However, if you don't have an ability to pay your property taxes this year, you can apply to have late fees waived. Go to the county tax assessor's website. That's Henry Levy, I believe, is our tax assessor in Alameda County. Go to the tax assessor's website and fill out a request to have late fees waived. And then I believe the taxes will be owed in July. Dr. Moss, the next question is for you. Can you read it yourself?
Yes. So I've had COVID-19, and the question is is about reporting, and I'm apologies for saying something confusing. Medical providers and laboratories that do testing have to report certain conditions to the public health department by law, and COVID-19 is one of those. They're typically things where the public health department can take action to protect the broader community. So it's not an individual community members who need to report, but it's their medical provider or the testing provider. So I hope that clears that up. I do want to recognize that it has been difficult to get testing for some people, and people have COVID or what is likely to be COVID, and they haven't been able to test. And that's why we really want to support the activities of the City of Oakland and Kaiser and others to increase access to testing, not just for people with Medicare, but all kinds of community members.
Yeah, and I just wanted to chime in here. It is really your doctor's responsibility, or your primary care provider, if you will, to report. So that's definitely owned by the providers, and then also the laboratories are reporting in addition to that as sort of a safety net, if you will. The other thing that I'll just sort of underscore, and there was a question earlier, who should be getting testing specifically? Ideally, we're testing people who have the actual symptoms of COVID, so the cold, cough, flu-like symptoms. In addition to that, people who have fevers. You don't have to have a fever to have COVID, by the way, but if you do have a fever, we're ideally aggressively testing for that. And then expanding beyond that, to Dr. Moss's point, We really want to get to the point where we can actually test around someone who actually has the infection. And just to give you a sense of really what we're talking about, on average, somewhere between 10 to 15 people have close contact with an individual who has COVID-19. So we have to have enough tests available, not just for the people who are having the symptoms, but then, multiply that by 10 to 15 to really ramp up. So that's when Dr. Moss says we need to have thousands of tests in Alameda County as opposed to hundreds of tests per day. That's really why.
Great. I see a lot of questions about the barbecues around Lake Merritt and people not feeling comfortable because not everyone is using a mask. I just want to acknowledge that this is a very difficult time. I know when I go out with my family, we've been taking a family walk every evening. And I do encourage people to find ways to attend to your mental health. This is a very stressful time. But just know that you're not alone in feeling anxious about being in public spaces. And one of the reasons that we were excited to start the Slow Streets program was we were hearing a lot from people who usually use Lake Merritt as their kind of outdoor retreat that were feeling very uncomfortable about the level of crowds there. It is true that picnic areas, tennis courts, playground structures are closed to the public. And it is sometimes difficult to enforce that. We are continuing to try and add signage, but I encourage you to tell people that you love them, you don't want them to get sick, and that you hope they consider wearing a cloth mask and not touching surfaces in the public because, in Oakland, we really love one another. I know it's a hard time. Just one of the doctors want to talk about, though, why masks are not required when people are exercising outdoors. It seems like the masks are more required for indoor spaces than outdoor. Either of the doctors, do you want to comment about that?
Yeah, no, I think it's a great question. When you think about it, COVID-19, it's all about how is it really spread. And it really is close contact with an individual. And actually, most of the information out there would say that it's relatively more prolonged close contact. So that's like the people that are household members with someone. And it's not that easy to catch in terms of, somebody just running by you, where there's literally minimal contact. And you can imagine, just from a practical perspective, it's pretty hard to wear a mask while you're exercising. But that's actually not the primary way that it's spread. It's really when you have, general close contact with someone, primarily in a household, or if you're really sitting next to somebody for a prolonged period of time. I don't know if Dr.
That's why I guess when you see,
I agree.
Oh, sorry. When you see groups of people out are close together, often they're in the same household, right? We can be close to people in our same household, right?
Well, that's right. And, again, it's continued vigilance for all of us, right? So it's all the same things that we've done with flu in the past, where you try to avoid contact with someone who's obviously sick, who's out there and might be coughing, and for ourselves, using those masks that we were talking about. And if you don't have access to a mask and you have to cough or you're sneezing, that you're using and coughing and sneezing into your elbow like this to protect the others around you and to protect the members of the household. I think that's really key. And then the last thing, I would be remiss that, you got to wash your hands, and it's washing your hands for 20 seconds if it's soap and water, or the alcohol hand gels work perfectly fine too.
Oh, and I forgot to add that we actually are working with our business improvement districts to put hand sanitizer stands out in our commercial areas. So someone had asked about that earlier, and I had neglected to say that. We are getting to the end of our time together. I want to invite each one of our speakers to just offer some closing remarks. If the camera can go back, why don't we start where we started, and that is with Kim. Kim?
Yes, I want to say two things, which is first of all, to all of us who are younger adults, because we are in this together, to make that call, to make that check-in call. We have a whole toolkit at engageca.org, engage with the age capitalized, but engageca.org. Make the call, check in on food, check in on safety, check in on fraud, check in on loneliness. And we have helpful numbers to help you with all of those things. As those checks are arriving, Mayor Schaaf, the frauds are coming up too. So check in. And for older adults, I just want to say thank you. May is Older Americans Month, and the theme is Make Your Mark. And never before have older Californians made their mark more than they are right now by saving lives in our community, by serving in our communities in so many ways. So we're collecting stories and videos and want all older Californians to share with us how you're making your mark and really are the heroes of the moment. So thank you.
Great, thank you. Dr. Perotti.
Thank you. So, what I really want to say is that I was watching all of those questions and realizing, how the shelter in place, while it has saved lives, it is a hardship. And I want to call out and thank all of you for contributing to saving each other's lives. And that if you have questions, if you want to know whether you should be tested or not, or whether you need to come in or not, please call your doctor, call your provider. Get the help that you need, and support each other. This is a trying time emotionally. And so being there for each other, or again, calling your provider for that kind of help too, I think is equally important, because there's a different, we talked about the surge of COVID. There's a surge of other diseases out there, and there's a surge of loneliness, depression. And we have to support each other through this and get through this. That's the only way this is going to work.
Great, thank you. Dr. Moss.
Well, first of all, I wanted to thank you again, Mayor Schaaf and the City of Oakland, for giving the Alameda County Public Health Department and our Healthcare Services Agency the opportunity to join the call and share information about what we do and what will help us get life a little bit more back to normal. And then I also just wanted to echo what Dr. Perotti was saying, and to really thank all the community members who have borne the brunt of this, but also by sheltering in place and by wearing masks and really doing all that we're asking, have actually made an impact and have taken care of each other. So I want to thank you.
Well, thank you all. Thank you for tuning in tonight. There is a survey. Please take a moment to take the survey and let us know whether this town hall was interesting, whether you got your questions answered, and what kind of experts that you want to hear from in the future. As your mayor, I am committed to doing these town halls every week. It is so important that in this virus where we have no vaccine, we have no cure, information is our best weapon to keep healthy. And so please let us know what information you want. Also know that I post a daily message every day, except for Thursdays, because I'm here, every day to give some quick updates, useful resources, because this is a quickly changing situation, and we want to keep you informed about what resources are there for you. And I will be excited to share with you in the coming days as we have more details about when exactly we're going to open that East Oakland testing site, made possible by CORE, Verily, and our own Governor Gavin Newsom. So Oaklanders, you heard it from all your special guests. Check in with each other, take care of yourself. Please heed the advice of our health professionals, and we will get through this together. I'll see you next week.